Medically known as rhinosinusitis, a sinus infection occurs when your nasal cavities become infected, swollen, and inflamed. Sinusitis is usually caused by a virus and often persists even after other upper respiratory symptoms are gone. In some cases, bacteria or rare fungus may cause a sinus infection. Other conditions such as allergies, nasal polyps, and tooth infections can also contribute to sinus pain and symptoms. Sinusitis is an inflammation or swelling of the tissues lining the sinuses. Sinuses are hollow spaces within the bones between your eyes, behind your cheekbones, and in your forehead. They make mucus, which keeps the inside of your nose moist. That in turn helps protect against dust, allergens, and pollutants. Hello dear viewers, welcome back to our channel. Today we have brought to you sinus infection or sinusitis symptoms, causes, and prevention measures. So watch the video until the end to never miss a thing. If you are new to the channel and if you like our content, please consider subscribing to our channel and smash the notification bell so that you'll be the first one to be notified when we upload new videos. Our YouTube analytics show that more than 90% of our viewers are not subscribed. Your subscription means a lot to us and encourages us to create more content. If you're already a subscribed member, please like and share this video so that it could reach a wide range of audience. A sinus is a hollow air-filled cavity. For the purposes of this video, a sinus will refer to those hollow cavities that are in the skull and connected to the nasal airway by a narrow hole in the bone, or ostium. Normally, all sinuses are open to the nasal airways through an ostium. Humans have 4 pairs of these cavities, each referred to as the frontal sinus in the forehead, the maxillary sinus behind the cheeks, ethmoid sinuses between the eyes, and the sphenoid sinus deep behind the ethmoids. The 4 pairs of sinuses are often described as a unit and termed as paranasal sinuses. The cells of the inner lining of each sinus are mucus-secreting cells and some cells that are part of the immune system. Functions of the sinuses include humidifying and warming inspired air, insulation of surrounding structures such as eyes and nerves, increasing voice resonance, and as buffers against facial trauma. The sinuses decrease the weight of the skull. If inflammation hinders the clearance of mucus or blocks the natural ostium, the inflammation may progress into a bacterial infection. Healthy sinuses are filled with air, but when they become blocked and filled with fluid, germs can grow and cause an infection. Conditions that can cause sinus blockage include a common cold, allergic rhinitis, which is the swelling of the lining of the nose caused by allergens, small growths in the lining of the nose called nasal polyps, a deviated sputum, which is a shift in the nasal cavity. Pain is often a common symptom of sinusitis. You have several different sinuses above and below your eyes as well as behind your nose. Any of these can hurt when you have a sinus infection. Inflammation and swelling cause your sinus to ache with a dull pressure. You may feel pain in your forehead or either side of your nose, in your upper jaws and teeth, or between your eyes. This may lead to headache. When you have a sinus infection, you may need to blow your nose often because of nasal discharge, which can be cloudy, green, or yellow. This discharge comes from your infected sinuses and drains into your nasal passages. The discharge may also bypass your nose and drain down the back of your throat. You may feel a tickle, an itch, or even a sore throat. This is called postnasal drip, and it may cause you to cough at night when you're lying down to sleep and in the morning after getting up. It may also cause your voice to sound hoarse. Your inflamed sinuses may also restrict how well you can breathe through your nose. The infection causes swelling in your sinuses and nasal passages. Because of the nasal congestion, you probably won't be able to smell or taste as well as normal. Your voice may sound stuffy. The relentless pressure and swelling in your sinuses can give you symptoms of a headache. Sinus pain can also give you earaches, dental pain, and pain in your jaws and cheeks. Sinus headaches are often at their worst in the morning because fluids have been collecting at night all night long. Your headache can also get worse when the barometric pressure of your environment changes suddenly. As the discharge from your sinus drains down the back of your throat, it can cause irritation, especially over a long period of time. This can lead to a persistent and annoying cough, which can be worse when lying down to sleep or first thing in the morning after getting up from bed. It can also make sleeping difficult. Sleeping upright or with your head elevated can help reduce the frequency and intensity of your coughing. Postnasal drip can leave you with a raw and itching throat. Although it may start as an annoying tickle, it can get worse. If your infection lasts for a few weeks or more, the mucus can irritate and inflame your throat as it drips, resulting in a painful sore throat and hoarse voice. When you look at the types of sinusitis, the first one is acute sinusitis. It usually starts with a cold-like symptom such as a runny, stuffy nose and facial pain. It may start suddenly and last 2 to 4 weeks. And the second type is the subacute sinusitis, which usually lasts 4 to 12 weeks. And the third type is the chronic sinusitis. Symptoms last 12 weeks or longer for this one. And number 4, recurrent sinusitis. It happens several times a year. When you look at who gets it or who is susceptible for this, lots of people are susceptible for this infection. About 35 million Americans have sinusitis at least once each year, and it's more likely if you have one. And the indications include a swelling inside the nose like from a common cold, blocked drainage ducts, structural differences that narrow those ducts, nasal polyps, immune system deficiencies, or medications that suppress the immune system could all cause this type of infection. For children, things that cause sinusitis include allergies, illnesses from other kids at daycare or school, pacifiers, bottle drinking while lying on the back, and smoke in the environment. The main things that make sinusitis more likely for adults are infections and smoking. When you look at acute sinusitis symptoms, the main signs include facial pain or pressure, a stuffed up nose, runny nose, loss of smell, cough, or congestion. You may also have a fever, bad breath, fatigue, and dental pain. It may be acute sinusitis if you have 2 or more symptoms or thick green or yellow nasal discharge from the above symptoms. Regarding chronic sinusitis symptoms, you may have these symptoms for 12 weeks or more. A feeling of congestion or fullness in your face, a nasal obstruction or nasal blockage, pus in the nasal cavity, fever, runny nose, or discolored postnasal drainage. You may also have headaches, bad breath, and tooth pain. You may feel tired a lot. Lots of things can cause symptoms like this. You will need to see a doctor to find out if you have sinusitis or not. Regarding treatments, if you have a simple sinus infection, your doctor may recommend you to use a decongestant and saline nasal washes. You shouldn't use an over-the-counter decongestant for more than 3 days though, because it can make you feel more congested. If your doctor gives you antibiotics, you'll probably take them for 10 to 14 days. The symptoms usually disappear with treatment. Warm, moist air may also help if you have chronic sinusitis. You can use a vaporizer, or you can inhale steam from a pan of water or warm water, and make sure the water isn't too hot because it causes other complications. There are some other things you can do yourself to help with chronic sinusitis. The first one is your warm compresses can ease pain in the nose and sinuses. Therefore, you can use this technique. You can drink plenty of fluids to keep mucus thin. You can use saline nose drops, which are safe to use at home. You can take over-the-counter decongestant drops or sprays, which can help. And what you should take care is don't take them longer than recommended. In some cases, your doctor may prescribe steroids along with antibiotics. When you look at other options you have, you may need to avoid any triggers like linked to your sinusitis. Every person has trigger for this problem. Therefore, identifying your trigger factors and avoiding them is the best solution. If you have allergies, your doctor may recommend some medicines for that. If a fungus is to blame, you will get prescription for antifungal medicine. If you have certain immune deficiencies, your doctor may give you medicines to increase your immune system, to improve your immune system, which helps fight the things your body reacts to. And finally, when we look at the techniques you can use to prevent sinusitis in the first place, there is no surefire way to prevent sinusitis, but there are some things that might help. Number one, don't smoke and avoid other people's smoke. Number two, wash your hands often, especially during cold and flu season, and try not to touch your face. And number three, stay away from things you know you are allergic to. Talk to your doctor to see if you need prescription medicines, allergy shots, or other forms of immunotherapy. If your sinus problems keep coming back, ask your doctor about the pros and cons of the surgery to clean and drain the sinuses. Well, dear viewers, as you can see in the video, we have presented sinus infection or sinusitis symptoms, causes, and prevention measures. Let us know of your opinion in the comment section. By now you know that our channel is full of inspiring videos which you can use daily in your life. If you like our content, please consider subscribing to our channel if you haven't already, and also smash the notification bell so that you'll be the first one to be notified when I upload new videos. Thank you for watching until the end. We look forward to seeing you in our next video. Until then, stay safe and stay blessed.